So, Aunt Anne, I see that you came home to do this interview.
Yes, I love coming home. Mom is not here anymore, but still love coming home to the house. Came home last summer, thought I'd be afraid, but I wasn't. She didn't come back.
She didn't come back.
And I just love coming home. It's so different than St. John's.
Mm-hmm.
Completely different life.
I see, Aunt Anne, you brought Tony home with you for this weekend. Spousal is very important during this journey.
Very important. I don't know what I'd do without him.
Well, and I'm happy to do anything for you, and I realise that when you're going through something like this, it's good to have someone there with you to help you through the journey.
Even going to the cancer clinic, even the parking, he'll drop me off at the cancer clinic and he'll go park, whereas I would have to go by myself. He does everything now.
Including cook.
Cook, clean. I just don't have the energy. I don't have the desire. Since I got cancer, I don't have the desire to cook. He goes to all my doctor's appointments.
Good.
And I take him with me because I wouldn't remember what they say. So he comes in and listens to whatever the doctors are saying to me. And the day of my chemo, I am there for 8-9 hours. And Tony's just sitting up in the chair.
So he's been your rock through this.
He has been my rock. And my family has been good.
There's a few of us.
Constantly calling, and not every time could I answer the phone, but Tony would answer the phone.
Yeah, a lot of family support and a lot of support from friends as well, and,
Yeah.
and it helps through, just little stuff helps her get through the day some days.
Yeah.
I heard a lot of your friends from Outer Cove and Logie Bay showed up on your doorstep Christmas.
Yes.
You want to tell us a
they
little
did.
something about that?
That was amazing.
Did you
I
know?
had no idea. And I just caught a glimpse of one or two people outside. But I said, that's Jerry next door, because Jerry comes over with the kids and takes pictures with all the Christmas stuff, right? And Tony put on my coat, and then he shoved a hat on me, and with that the door open, and it was Blair, our neighbour. And when they opened the door, I just couldn't believe it.
Jingle bells, jingle all the way. Oh, what fun it is to ride in one horse sleigh. Hey, jingle bells, jingle all the way. Oh, what fun it is to ride in one horse sleigh.
So it was probably about 80 or 90 people from the town
Yeah.
came down and sang Christmas carols. They wanted to do something to town. The group wanted to do something to lift her spirits, and during Christmas,
Yeah.
and it certainly did. It gave her a big
Oh
boost
my
to know that
God.
everybody
Yeah.
would come out on a blustery night like it was.
It was
to sing carols for
cold
her.
and windy and rain and snowing and you name it. And I'd never experienced anything like it before. I was just, oh my God. That's all I could say was, oh my God. Oh.
You're an inspiration to us all. When I tell of someone diagnosed, I'm like, contact my Aunt Anne.
Yeah.
You're having a bad day? Contact my Aunt Anne. How were you diagnosed?
Well, I was having cramps in my lower stomach and pain up in my shoulder. And when I would laugh, the pain in my shoulder would get worse. This Sunday morning I got up, I said, Tony, we gotta go to St. Clair somewhere to emerge. Like, this is not getting any better. They did a CAT scan, I think it was.
Yes, you had a CAT scan.
CAT scan, and they said that a shadow showed up on it, which didn't mean anything to me. And excuse me, I went home and we went out the next week, and I think must have been
No,
this.
you went to your family doctor, and based on the CAT scan, thought it could be an infection. So we're
Oh,
treating you
right.
for on antibiotics to see if it would clear up the infection.
Yeah.
And then coincidentally, you went to your regular appointments.
Oh yes, for my regular pap test, and
Look at
and that came back fine. But when she was doing the pap test, she said, "Would you mind if we did a biopsy?" And I said, "Sure." And she said, "It's going to hurt." I just remember her saying that and holding her hand, just squeezing it. And that was all I thought of it. We went out to Central for Easter weekend, Skidooin, and we had a call to come in and see her right away. And Tony said, "There's something up." And I said, "No, she got the report from St. Clair's and seen the shadow, and she just wants to talk about it. That's it." And when I walked in the office, there was nobody else there, which I thought strange. And I went in, and she said, "We have some bad news for you." I said, "What do you mean bad news?" She said, "You have cancer." Keely was having her leaving ceremony from McDonald Drive, and she had her dress ordered. And sorry. And I said, "I'm not going to get to see her in her new dress." But I did. And then I set my goals on seeing them past grade 12. Now my goal is seeing them graduate university.
It's good gold.
Yep.
Yep.
Every
That's
step
what you
in
need.
their life, I set a goal.
Yep.
And
Yeah, so the biopsy, she did that. That was coincidental. So luckily,
Yeah.
she did the biopsy, and
It
then
was
they
fluke.
knew what showed up on the CAT scan. Then
So that wasn't a part of the
no,
regular.
that was sort of something she
It was
did.
just extra.
it
Extra.
wouldn't show up on a pap,
On
a regular pap test.
No.
So the fact that she did it, so then they knew that that's what you had, and that's what the CAT scan showed. So then that moved things along much quicker. Then she was referred to the cancer center,
Yeah.
and she saw the gynecological oncologist there, and then things went into motion with surgery and treatment from there.
Yeah. That's
The normal.
I had none of the normal symptoms of uterine cancer.
So you went because you had a bad shoulder,
My
basically.
shoulder was
Yeah.
whenever I'd laugh.
And we were laughing
did a
at
lot
her.
of laugh. We did a lot of laughing.
Yeah.
And I remember calling Tony, and then we had to go in and tell Jordan and
kids.
Keely.
Yep.
And that was very difficult. Yeah. So we decided, okay, what will we do? What will we say? And I said, I don't want to sugarcoat it to get a no. And that's what we did. We went in and we called them from the rooms, and they came down and we told them, and they cried. They hugged me.
When Mom came home from the doctor, it was a shock. Wasn't expecting it at all. Didn't know that she got tested or whatever she did, got the biopsy. So really had no idea. Remember she came in crying, and she waited till Dad got home, but she was crying and me and Jordan didn't know why. And then she told us, and I think I cried. I can't really remember, but I remember it was kind of like it didn't set in at first, I guess.
The first day she came home, I guess it was shocking. Keely said we weren't expecting it. She seemed fine and healthy, but it's clearly she wasn't.
Hard, I guess. It's hard to see her sick all the time, and you're always worried about her, if she's okay, or... Oh my God, I gotta stop.
We are here today at the Dr. Bliss Murphy Cancer Center with Dr. Patty Power, gynecological oncologist with Eastern Health. Dr. Power, how common is uterine cancer?
Uterine cancer is the most common gynecological malignancy. There are some really important risk factors in the development of a uterine cancer. The three most important risk factors are family history, inappropriate use of hormones, and obesity. It's really important for women to know about other cancers in their family. It's really important for women to try to keep their weight within a reasonable range. And it's really important to only use hormonal treatment in close conjunction with your family doctor or gynecologist. Uterine cancer is most often detected when women have abnormal uterine bleeding. This bleeding can happen after menopause. This bleeding can happen after sexual intercourse. This bleeding can happen as an irregular pattern between menstrual cycles. But the most common time that we see patients with a uterine cancer would be in a woman who has already gone through menopause at an average age of 60. It's abnormal to have vaginal bleeding after you have completed menopause. Any patient who has abnormal bleeding after they have completed menopause should see their family doctor. Uterine cancer is generally very easy to detect if women present. If you have abnormal bleeding, your family doctor or gynecologist are going to perform a speculum exam. You'll likely have a pap smear at that time, and usually we will sample a small area within the uterus to help detect any abnormal cells. Well, trying to decrease your risk really depends on your understanding of what your risks are. So we talked about family history before. We also talked about having extra weight on, which is a known risk factor for developing uterine cancer. Some important things you can do. Obviously, you can't change what you've inherited from your mom and dad in terms of your gene pool. You have no control over that. Certainly, most women have control over a healthy lifestyle and keeping their weight within a healthy range. Lots of exercise, those sorts of things. So healthy living, lots of exercise, decreasing your fat intake, these are all things that can have a dramatic improvement in reducing your risk of developing a uterine cancer. Now, if we happen to identify some precursors to uterine cancer, then we have some tools within our within our clinical plan for a patient to help reduce those risks. Sometimes they may mean taking a medication that helps shed the lining of the uterus to get rid of all those abnormal cells. Sometimes it may mean putting in an IUD that has some hormone to also help shed the lining. And the whole concept of shedding the lining of the uterus is to get rid of all those precursor cells that may eventually develop into a uterine cancer. Not everybody needs surgery, and in contrast, some individuals who have other medical problems, they may be obese, they may have hypertension, they may have had previous surgeries, they may have heart issues that may preclude them from being safe. We have some other tools that we can use to help women that have developed a uterine cancer apart from a surgical approach. Some women may get radiation, some women may even get chemotherapy depending on the situation. But I would say 80% of women, when they present with a frank malignancy, will have a surgical approach with the hysterectomy, cervix, uterus, fallopian tubes, and ovaries removed.
Has your life changed? Obviously it's changed since you've been diagnosed, but you said previously that you set goals. I need to see my kids graduate high school.
Yeah.
And now it's university. Is this what gets you through?
Yep.
Your children and your family?
I'm going to see them.
Exactly.
And I'm going to see them get a job.
Yep.
What happens after that, I don't know. I'll set some other goal.
It's grandchildren then. You've been around for your great nieces and nephews. Why not grandchildren? Do you have any advice to give other patients who are going through this?
First of all, you got to find out what you've got. There's different symptoms.
Yeah, but I think probably important for you, or what you did, is you listened to your body. You knew there was something wrong. And
Definitely.
She kept going to say. What I was going to say is for people to ask a lot of questions and don't be afraid to ask questions of your doctors, because they want to tell you stuff. It's just that if you don't understand it, they tell you something sometimes, and you might not truly understand what they're telling you. So, and they're fine with you asking again questions to explain it better, and just because you don't understand or how they have it framed up. So I think the more you know about things and what to expect, it helps you get through what you're going through. Certainly, I think that's the way it was for Anne. That having a good idea what to expect as you're going through the treatments and what to expect afterwards. At least you know what's coming, and then you can helps you deal with it a bit more. But and keeping a good attitude about it, Anne did throughout the whole time, the last 5.5 years, a really good positive attitude, and look forward to getting out and feeling better and doing stuff when she felt better. So I think that helped her and kept her. The whole system, you hear sometimes you hear a lot of negative stuff about the health
system. Mostly what you hear,
But our experience as we went through it the last 5.5 years has been excellent. Everybody did whatever they could do for Anne to help her, and great experiences. Everybody, I can't think of anybody.
No,
really
I can't either.
That wasn't helpful and caring in the treatment that they gave.
Yeah.
You spoke about when you got diagnosed, and you had CAT scans and everything. What treatments did they do?
Chemo.
Chemo?
Chemo.
How was that?
It was difficult. The first year wasn't too bad, but every year since, it's harder and harder to come back. I go in and they give me my chemo through my port, and I'll sleep all day.
It's hard on her body. It's hard to recover from, but at the same time, while it's tough, it's what's keeping her going. And it's what she had several surgeries, and then now she's had I think 5 rounds of chemo over 5 years.
Was it?
Yeah, over the 5 years. Things to do that helps her get through it. Drinking lots of water, trying to eat well, and get rest when she can. And that's one thing that was hard for her at first, is knowing that she had to take a rest. Even though she felt tired, she wanted to be up doing stuff, but really she had to rest and let herself recover. And she did recover. One of the things Anne mentioned there was her port. So she has called a power port. Where her is an IV that's permanently installed, I guess, and that's something that people should look at if they're if someone is diagnosed and has to go through chemo. Certainly a question to ask to look for a power port, because what it does. I remember first she didn't have it the first couple times, and she had to get IVs all the time. She didn't like getting the IVs in her arm, and it was a bit of trouble sometimes. But with this power port, there's no issues with that at all.
So,
She goes in and
Don't even know it's there.
they can access it easily.
So it's not standard for them to put in the port?
For some types of chemo, I think it's a
Yeah.
standard thing, but for hers, it wasn't.
See, her veins are not great, so this saves her vessels. This way we have direct access. Her veins, it might take a couple times, her veins have collapsed over the years, so this works much better.
Yeah.
I could give someone advice. I'd tell them to ask for that and see if it's possible to get
Yeah.
it right from the beginning, because it just makes life a little easier when you go for treatments and for tests, for the CT scans and different things. They also access that instead of an IV, so just makes it more convenient
Yeah.
and a bit easier. But the chemo is, even though it's very hard, they do everything they can. There's lots of advice, and from what they told us, it's certainly come a long way. There's side effects, but they have done everything to mitigate the side effects, medication for nausea and to help with energy prior to and during the chemo. So those side effects are minimal most of the time, and so while it's hard, it's the after effects are probably the worst, as opposed. So from the energy wise and that, as
Yeah.
opposed to actual sickness and nausea, and that she didn't experience a lot of that
No.
through the chemo.
No. But it was the exhaustion that my kids were there and they wanted supper, and I couldn't do it. I just couldn't get up and get them supper.
A few months ago, you came home with a letter from a geneticist in St. John's. And you
Yes.
gave it to all the female members of our family. And it was
And brothers.
And brothers. Oh, the brothers as well.
It could be in men as well.
So I went and got tested, and thankfully all of my chromosomes came back normal. But I wasn't tested for the uterine cancer that you have. It was an abnormality on the PAL-B gene, and it was a breast cancer gene.
Yes.
Breast cancer is everywhere in the media.
Everywhere.
Everywhere. Why aren't women talking about uterine cancer the same? I know that your cancer wasn't picked up by genetic testing,
No.
but should it be something that women get done, and men? Should it be
Yes.
something that is more common than it is?
Family history is really important in any cancer, and you need to keep it in the back of your mind when you go see your family doctor, when you and your family doctor are assessing your risk. Some of the uterine cancers are associated with mutations that we might inherit from our parents that can be associated with other cancers, like colon cancers. In contrast, some cancers may be related to breast cancers or ovarian cancers. So it is really important to have a good sense of who in your family has developed a cancer and how that might translate to your own individual risk.
The only downfall with the genetic testing is the insurance part. Say I got checked and I'm a carrier, which I am. Jordan and Keely, my children, they haven't started work yet. So they got to apply for insurance.
Yeah, it could impact them getting coverage
Getting
in the future
insurance
for health
coverage.
insurance or life insurance and those type of things. So there is that risk, and I think
Is this
that's
the reason why people are not getting tested, do you think?
I don't think. I think until you get it, I never ever thought about uterine cancer, or because I thought Pap test covered everything.
Mm-hmm.
That was my belief, that if you were getting your Pap test done, you're
okay.
safe. 24 years ago, I had severe dysplasia, which is precancerous cells, and having Pap test done, and it was never picked up.
and that wasn't related to the uterine cancer.
No.
That's cervical cancer.
Yes.
And that's why that would have been picked up on the Pap test. But there's no discussion of uterine cancer and testing for uterine cancer and what the
there's
risks
nothing
are.
out there.
You don't hear much about it. When Anne was diagnosed, I looked to see what there was, and yes, you can find out about what some of the symptoms are if you dig deep enough. But there's no promotion. There's no. there's no campaign to have people tested for uterine cancer and the different types of uterine cancer, because there's different kinds, and it has different effects on women, and was a bit more of a rare type of cell and than most people have, and so her prognosis and diagnosis is a bit different than a lot of people. But there's nothing, you don't hear anything about it. People aren't talking about it.
Uterine cancer, which is really cancer of the lining of the womb, is in fact the most common gynecological cancer in North America. Outside of breast cancer, of course, which we don't really consider in Canada a gynecological malignancy. Certainly the incidence of breast cancer would be much higher. But of all the gynecological cancers we see, uterine cancer is the most common. So in a lifetime, a woman would have about a 3% chance of developing a uterine cancer as opposed to, an 8 or 9% chance of developing a breast cancer. So it's by far the most common malignancy that we see in our practice.
I don't know why, we don't know why people don't talk about uterine cancer, and it's not something that we heard much about until Anne was diagnosed, and then we hear a lot about it, and Anne certainly talks to people about it and tells people that she has it and what happened to her.
I'm not shy about it. People need to know.
People need to know. We all need to know.
That's like when I tell people, a pap test is not going to find it. They say, what? I thought a pap test found everything. I said, no, pap tests don't find everything.
So what found it? Was it the biopsy?
The biopsy.
Well, if there's any good news about this particular cancer, it's that usually there's a sign. So most women who present with this cancer are going to have abnormal bleeding. So we always counsel and educate the medical students and the family docs that if a woman has gone through menopause, for a period of a year, and there's any signs of vaginal bleeding beyond your menopausal period, it's really important to have that evaluated. When women present with abnormal bleeding, then we can proceed to sample the lining of the womb to make sure there isn't, a detection of a cancer up inside the lining of the womb. So that's also why most women that get this disease present at a very early stage. And we get lucky with this disease because there's a sign, we can pick it up early. Now, there's not really a good screening test. There's not a blood test to pick it up. There's a lot of misperception that, there's a blood test that can pick up certain kinds of cancers. There aren't. But very important to, know your body, pay attention if there's something abnormal happening, and present to your family doc early.
Is there anything you want to tell everybody?
Well, there
Any
are, you can have spotting. What else?
Well, the symptoms, there's symptoms of bleeding and things, but with regards to testing, there's not much testing, I don't think, to do, other than there is a blood test, but it's not conclusive. Cancer antigen, CA125 blood test, but that's not conclusive because it could be false positive, on that, so it doesn't mean, so they don't regularly do that as a screening tool of someone who's not already diagnosed. So there's not much that I'm aware of that you can do other than the biopsy is the way that is confirmed.
Yeah.
If you have symptoms, and we can look back retrospectively, and she may have had some symptoms, but nothing like the ones that you would read about and expect that you would have.
Yeah, the normal process would be if a woman has any bleeding to present to the family doctor and sort of talk about what might be happening. Only a cancer is detected about 10% of the time. So there are other causes of bleeding in a woman who's already gone through menopause. But it's really cancer until proven otherwise. So you need to rule it out. There's a very simple way we can do it in clinic. We don't really call it a scraping, but we put a little tiny plastic straw-like tool into the uterine cavity, and just with very gentle suction, we sample some of the cells, send it off to the lab, and the pathologist under the microscope can tell us if there is any malignancy there, if the cells are normal. The other good thing about the most common kind of uterine cancer is there's often a preceding abnormality within the lining of the womb that we can pick up. So there's a gradual change in how the cells look under the microscope, and sometimes we can intervene early to prevent development of a uterine cancer. There are other tools that we can use, but really the gold standard for us is getting some tissue inside the lining of the uterus.
It's hard to know what she could have done any differently, other than if she did know she was a carrier of a gene, which she's not, but if she did, I guess she could be more vigilant on having a biopsy, even though she did have one, or the blood work as well may have been something.
Like right now, I know that I'm the carrier of this breast gene. So with that and the uterine cancer, Keely, my daughter, will have to be kept a close eye on, which makes me very sad that, you know, I might not be here. And
There are different types of uterine cancer. There are two main types. Some are more closely associated with family history, and some are more closely associated with obesity. So when we think about two separate categories of uterine cancer, by far the one we see most often would be in the 60-year-old woman who would have some extra weight on, because having extra weight on is a known risk factor for uterine cancer. The other type we see is a type that's more concerning to us, more risky in terms of presenting a little later, and higher incidence or chances of it spreading to other places. It can also be associated with family history, but the genetic mutations are found to be a little different in those types of cancers. So our approach to those cancers is different, and how we counsel patients is different.
So a lot of people, as we said, are not talking much about uterine cancer and about the genetic tests that can be done. So as individuals, it's an individual decision if they're going to have genetic testing done or want to have it done, I guess.
Yeah.
Because there's other downside of having it. Some people don't want to know, but I think it's probably a good idea to know, and at least you can take those proactive measures to try to determine if you have it and catch it early, and get the treatment as early as you can.
now there are some in the family who will not have it done, and that for a couple, it's because their children are not finished university yet, and they have to go out looking for a job and for their insurance and everything. So they don't want to get checked until after they're finished and got a job. And
So can you tell us what process you went through to get the genetic testing? How, if I wanted to go tomorrow and get tested, how would I go about it? Is it as simple as walking into a doctor's office and getting...
No, I don't think so. You had to be referred to a geneticist. There has to be already some family history, I think, and they look into it. I'm not sure what would happen if you just wanted to get it done, you asked for it, how that works. But for Anne, it was because she was already diagnosed with cancer, so they did the genetic testing to see if she was a carrier of a gene that was related to her cancer. For someone who hasn't been affected yet, I'm not sure what the process is. Maybe I'm not sure if it's as simple as just asking.
not sure.
The process of genetic testing depends on whether a patient actually has been diagnosed with a malignancy or whether or not they have a concerning family history. If a patient has already been diagnosed with a gynecological malignancy, such as a uterine cancer or an ovarian cancer, we will advise, based on the pathology report, whether or not genetic testing is indicated. Once the testing is performed, if a mutation is identified, the genetics counselors will then advise in terms of whether or not other family members may be at risk and whether or not other family members can be offered genetic testing. The general rule of thumb is if a patient has more than 3 relatives over 2 generations, or young cancers in a family, or multiple cancers within one individual, or even male cancers, then genetics referral can be considered. These referrals need to be made in consultation with either a family doctor or gynecologist. Once a genetics referral is made, The family history will be reviewed in detail, and the genetics counselor will decide whether or not genetics testing is appropriate. It's important to understand that still only 10 to 15% of gynecological malignancies will be associated with a known mutation. We generally advise to keep in contact with the genetics department in the event that new information arises with respect to mutations associated with cancers. We can do a very simple blood test to help determine if a woman and her family may be predisposed to developing a uterine cancer. It isn't appropriate to test every single patient we see. However, if you have a concerning family history, or if you've already been diagnosed with a uterine cancer, this testing may be appropriate for you, and you should meet with your family doctor or gynecologist to discuss it.
How this started with myself and Jerry, I was reading on Facebook one day, more talk about breast cancer, and there was going to be another run, and I just wrote in, why isn't there any talk about uterine cancer? There was nothing out there. And Jerry just happened to be looking on his Facebook page the same time I typed it in, and it just took off from there. But I would say the majority of women think they're safe if they're getting their pap test done. And they're not.
No, but that's what we were led to believe.
That's
Get
what
your
I
yearly
was
pap
led.
test.
Yeah. Like from the time I had that severe dysplasia back in '93, I've been checked every 6 months because that's precancerous cells, right?
The most common myth associated with uterine cancer is the fact that a pap smear picks up a uterine cancer. Pap smears are not designed to pick up uterine cancer. They're designed to pick up precancers of the cervix, which is the outside part of the uterus. Some women feel falsely assured when they have abnormal bleeding because their most recent pap smear was negative. I think the best advice for women is to have a family doctor, one, because you'd be surprised how many women and families don't have a family doctor. Develop a relationship with your family doctor. Pay attention to your own body.
The chemo itself is not difficult, but what follows is very difficult. Trying to get through 3 weeks of just pure exhaustion.
Kathy Cal is the primary nurse with the Gynae Oncology Division of Eastern Health. Thank you, Kathy, for coming today and speaking with us. So, Kathy, once a patient commences treatment here, can you describe some of the effects of the treatments that they will receive?
Sure. Treatment is dependent. The side effects are dependent on what the treatment is. Radiation has certain side effects and chemo has other. Primarily, we would see patients for chemotherapy. So normally with chemo, they usually have 6 cycles of chemo. So it's over a period of 3 to 6 months that they get chemotherapy. They usually have fatigue as chemo treatments go on. That's usually the primary symptom that most patients voice. Nausea is minimal, and vomiting, that usually is pretty well controlled. And some patients get what we call neuropathy, which is numbness and tingling of the hands and feet. That can either increase or not even show up until after treatment's over. And also some muscle aches and pains in the legs, depending on the treatment. Some have one, some have none. It's very independent. We really don't know until they start at their chemo how they're going to experience or what side effects they're going to have.
Are there follow-up procedures in place once the patient has completed their treatments?
Once patients are finished, normally we see the patients for 5 years on a total, sometimes longer, depending on the situation. Usually it's for 5 years. The first year or two, we see them every 3 months. That usually just includes a physical exam. So Dr. Power would examine the patient, and what that includes would be typical of what a patient would go through to have a pap smear, but we actually just use the speculum to look at the top of the vagina. When patients recur with endometrial cancer, if they have a recurrence or if it comes back, most times they'll report some bleeding or spotting, and that's usually at the top of the vagina, which is why that's the part of the exam. So normally we do that every 3 months. It's very important for the first year or two, and then it can get spread out over the 5 years.
And people don't understand the exhaustion either. They'll say, what's it like the flu? And I'll say, no, it's not like the flu. It's your whole body it just wants to flop down.
So is there anything you'd like for the women to know about this disease? Any advice you can give to us?
Well, I think probably, listening to your body.
What is the prognosis once a patient has completed treatment?
Well, the good thing about endometrial cancer is, as I mentioned previously, it is often detected at a very early stage. So more than 80% of women who get diagnosed with a uterine cancer are going to survive their illness, because that sign of vaginal bleeding is a real cue to the physician to initiate early investigation and intervention. So the one good thing is that 80% of these women will survive their disease, and they will be discharged from the cancer center after 5 years. And at that point, we may not say you're disease-free forever, but we would say the chance of you having a recurrence after 5 years is probably less than 1%. So in terms of prognosis, most women will do really, really well with this disease if they pay attention to their symptoms, if we can pick it up early. The women that don't have such a good prognosis are really the women who've had a delayed diagnosis. So obviously, if somebody presents to us and they already have had cancer sitting around their uterus for years and years and years, and it has spread to their lymph nodes and other body places, then obviously their prognosis is not good. But 80% of women are going to have a great prognosis if they pay attention to their symptoms. Women need an internal exam every year. Pap smear screening, although as I said is not used to detect uterine cancer, is still a very important part of the well woman check. And family history has to be emphasized. Some women with concerning family histories, or women that may have a predisposition to develop a uterine cancer, may have a different surveillance approach. But it's important that your family doctor knows about any new symptoms, any new bleeding, any change in bowel and bladder, any unexplained weight loss, and certainly any changes within the family history. If a patient is diagnosed with a genetic mutation, family members have the option of being tested as well. It's important for families and patients to understand their risks so that their family doctors and gynecologists can best look after them. Surveillance methods may alter depending on if a patient is general population risk or if they're a high-risk patient, such as somebody who may have an inherited mutation, which may predispose them to uterine cancer or other cancers. Some of these cancers aren't necessarily gynecological cancers, and some of these cancers may be in men. So it's really important to know your risk factors and avail of opportunities for genetic testing if your physician thinks you're an appropriate candidate.
If there's something up insisting that you get the treatments or the testing, I guess, that you can to determine if there is something. But that if someone is diagnosed with it, there's lots of help, there's lots of supports, the medical system, there's good treatments, and there's
as
hope.
hard as the chemo is, it keeps you alive.
And there's hope.
Usually I give them my number. They can call me in between visits if anything comes up. A lot of patients leave. We have such close connection when they're on treatment. We see them every 3 weeks or every 4 weeks. So they kind of get used to us. We get used to them. We see them so often that I always worry that they're going to forget to call if there's an issue after treatment. We also have a pharmacist on board too. So they can call either or if they're having any side effects that show up after the fact. Some of those side effects would be sexual dysfunction. Usually there's vaginal dryness, so we can speak to them about that. There are treatments for that. Other treatments would be that persistent neuropathy that I was talking about. Some patients may show up with that months later, and there are medications for that as well. Surgery side effects, sometimes there's a change in the bowels and the bladder. That may be ongoing for just the first 6 to 8 weeks. Usually it does improve. They find that the bladder control is not the same. And we usually just kind of, after the 8 weeks, if it's persistent, then we can order investigations if needed for that as well. There are many cancer centers across the country. There is no support group for endometrial cancer or uterine cancer, unfortunately, but we do have 4 social workers here. If I feel that I can't support the patient or offer the counseling that's provided, if it's emotional, usually I can refer them to social work. They can do supportive counseling. A lot of times, again, like I said, they're such a close relationship, we see them so often, that when they leave, it's sometimes anxiety may set in because they're so used to having someone there every 3 weeks that we're not there anymore. That's kind of what they feel like. That's not the case, and then they've had time to think about what they actually went through. So usually it may show up a year later, it could be 6 months later, they're going through fatigue, post-chemo side effects. So we have 4 social workers on board and they're fabulous and they can provide supportive counseling for the patient or the patient's family members for that matter. We also have 3 nutritionists here who can help with dietary side effects and anything like that or weight loss as well.
We're here today with Paula Newhook, social worker with the Dr. H. Bliss Murphy Cancer Center. What is the emotional impact of cancer on a person?
Cancer affects people in many ways. Aside from the physical impact, people are affected emotionally, psychologically, financially. It's also common for people to experience fear, anxiety, depression, financial stress, family relationship changes.
What services does social work offer at the Dr. H. Bliss Murphy Cancer Center?
As oncology social workers here at the center, we have 4 master's trained full-time social workers, and we work with patients and families who have a cancer diagnosis through the full array of the cancer. We would work with people at prevention, diagnosis, treatment. We work with them with survivorship issues, and then palliation and bereavement issues. Really, here at the Cancer Center, I think we have 4 main focuses. One would be on counseling. I think that's the biggest aspect of our jobs. And we would work with, as I said, the individuals, the patients and their families, their children, their parents, and anyone that's really involved that would seek our help. As the second component we would be working with these families with practical and financial issues that they may have. Oftentimes it's such a life change for people. They can no longer work, maybe, either during the treatment or sometimes thereafter. So we would assist people in looking at applying for such things as Canada Pension Disability, employment insurance, maybe some cases workers' compensation benefits. Then there's also the financial aspect. We are here at the Cancer Center, we provide radiation. We're the only site in Newfoundland and Labrador. So many people have to travel from all across the province. And so we would look to assist them with travel expenses, meals, accommodations. We would also look at such things as, some people who need prostheses or wigs. That would certainly be a financial avenue that would really cause some stress on people. And we would look at assisting with, getting them to apply for prescription drug cards to help with their medication costs. A third component that we would be involved in is education. And we would, work in helping to educate the patients on what they should expect throughout their cancer journey. And, helping to educate them on such things maybe as how their children may feel during this time, as well as we're called often to go out to community groups.
What are some of the other resources available to patients with endometrial cancer or other cancers?
There are a number of support groups across the province of Newfoundland and Labrador. And when you say endometrial cancer specifically, I know there are some lack of support groups in the community. And I think that just comes down to the fact that, you know, breast cancer is such a more popular cancer, if you say that. And so I think there's so many resources, a lot of support, and a lot of support groups out in the community for breast cancer patients and survivors. Same with the prostate. It tends to be a single person who decides we need support, and they tend to go out and then sort of get a group set up and get a group going. We partner with the Canadian Cancer Society. They have regular ongoing groups that would be more general. We run a number of our own groups fairly regularly. We do run a transitions group, which seems to be very popular. And for what the word means, it would be for people transitioning from being a patient to getting back to life as it was before their diagnosis. And that would be sort of an 8-week group that we run, and that would be for all the different types of cancer. And we're running a Living Well cancer group, and that would be more for advanced stages of cancer. You know, Cancer Connection would be another online and telephone way that people can connect with other people who've had cancers, has an endometrial cancer, and wanted to connect with someone else with endometrial cancer. Then they could contact Cancer Chat, and they would be resourced with another person who's had similar issues. And these days, I mean, it seems that people are looking more to be online, and lots of people seem to be really getting support and assistance from like online blogging and reading others' blogs and really seeing what other people who've gone through the similar experiences.
How important is family or spousal support to a female with cancer?
Support is a huge component. I mean, there's no question. Often females who come with a cancer diagnosis, I mean, they feel very vulnerable and oftentimes very alone. So, you know, that is the reality of it. They're facing fear, anxiety, oftentimes depression, and they're realizing that this may cause a change in their day-to-day activities and in their relationships with their spouses, and oftentimes will change the role that they are used to performing in their family. So having the support of a spouse is paramount. I mean, you know, it just helps that journey. From what females tell me, it just makes it that much easier to have the support, to have someone who cares, and from family members as well. I mean, often children, so that they are aware of what's going on. It definitely makes it easier on the patient. You know, part of our role here as well is to speak with the patients, the females. We offer to meet for couple counseling. We offer to see the spouses individually if they want it. And then, you know, again, bringing the couples back together. But I can't stress enough, you know, the importance of having that support from your partner at such a difficult time in your life.
So how will the message get out there? If Jerry provides the link, what do you encourage people to do?
To pass it on. Every person that sees it, pass it on to someone else, and that person will pass it on. You mightn't get every woman, but you will get majority of women to know what to look for.
So you see a lot of stuff on social media, and this is one, if you see it and view it, you should share it.
Yeah.
Share.
Share.
Share.